How are children and teenagers affected mentally from abnormal levels of lead in their system?
All right, I'm glad you asked that way. When we talk about poisoning, people expect to see folks laid out in a hospital bed, or they're looking for an arm growing out of somebody's head. But these are problems of how the brain functions, how it processes information, problems of mood regulation, going from anger to depression, problems of memory, attention, control of impulses, and just learning basic things like complex problem solving that you would find in math, reading comprehension. So all these things carry and they accumulate in a population across their life course. Now, I can't say because a child had a certain lead level, this will be the list of problems. What I can say that in a population, continued exposure to lead, even low-level lead exposure, shifts the curve to the left. So in a normal bell-shaped curve, you have the 5% so-called geniuses at one end and the 5% of below normal IQ at the other end. Well, lead exposure, like alcohol and other things, shifts the curve to the left, so you have more children who will need special ed services and interventions. So that can, over the course of a 3-year period, studies have shown that can cost as much as $38,000 more for education. So then you have the issues of educational attainment, dropping out of high school. With the mood regulation problems, it puts you in harm's way with the law enforcement and criminal justice system. And many people are not aware that Freddie Gray in Baltimore was a lead-exposed child at a higher level. And once again, the scale is tipped toward negative outcomes. It places a population in an at-risk situation, and the impact is devastating for a community. So it's a community health issue with manifestations in individuals.
You can get more information about the show and our guests at primarycare-tv.com and continue the conversation on Facebook and Twitter.